Welcome to the 4 o'clock work session of the February 19th, 2013 Board of Commissioners meeting. In our work session, we have 3 items to discuss. Our first one today is the quarterly report for the Downtown Tax Increment Financing District, presented by the Honorable Doug Gorman from the Warren County Downtown Economic Development Authority. Mr. DeFebo, do you have anything to add?
No other comments, and you preambled Doug. He's here and he's ready to give us good news, I believe.
Yes, sir.
I wouldn't agree with everything you said, Mayor,
but you're scaring all the rest of these people that are making these presentations there, Commissioner. Thank you so much for having me. I appreciate the opportunity once a quarter to come and kind of give you an update. There are a lot of exciting things happening. I've put a couple things down here on a slide. Actually, someone did, not me, but anyways. I want to kind of give you an update of where we are. This is a listing of what we've applied to the state for, and this is what our last report was as of the end of December 2012. And you can see all the different blocks and what those amounts are, and this is the capital investment. So we're at $159,304,000, and that's toward a goal of $150 million that we had to reach by December of 2014. So again, on a 6-year plan, 2 years ahead of time, and have passed that. So that's some great news there, and be happy to answer questions later about any of those numbers, but those are the ones that we're able to do. That's just our usual map. That hasn't changed and won't change, but those are the blocks. In case there's any questions, we can always go back if you want to know what those are. Just to give you a kind of an update, though, of what's going on currently. The biggest one is our HitSense Park Plaza that you're all intimately aware of, going on at Block 6. It looks like that HitSense and Connected Nation, the 2 tenants on the top floor of that, will start to be able to move in. If you've gone by there, you can see they're putting brick. It's a little interesting, but they're putting brick on the 4th floor, starting around there, because that's where the tenants are going. And so they've started that building, and it's okay. It meets all building codes. But they are bricking the 4th floor so they can be in. They'll work underneath them. But if you drive by there on 8th Street and take a look up, you'll see that brick going up there. And expected they'll be moving in June. Block 7 is the triangle piece of property that's behind SkyPack, and at Dollar General they are really working. They are really moving along pretty well. I actually saw crews out there on Sunday, which was interesting, but they are moving along very well on that, and that'll be open midsummer as well. The BGMU headquarters, the building itself will be open in spring, actually mid-April, and then the next phase is actually tearing down the old building. And many people probably have never been through that entire building. It looks awfully big, but the building they were in has a full basement, and it's a pretty good-sized structure. And if you look at the elevations, to be honest with you, of the new BGMU building, the parking lot, and the old building, you can see there's going to be quite a significant amount of dirt taken away as well. But as I like to point out, at BGMU, that building specifically, at the corner of Main and Center, which is one entrance to it, if you'll see the brickwork they've put up there, and BGMU has done a very nice job in the TIF design guidelines to make that. It's going to be a very beautiful building as well. The Alumni Center in Alumni Square up there, the ribbon cutting for that says April 12th, 2013. And if you have not been through that building, I'd encourage you to go on that day. It's a Friday. It is a great facility and something we'll all be very proud of. And of course, you can see the great progress they're making at the WKU Medical Center Health Sciences Complex, which is opening in August of 2013, but that building itself is changing the face of the, I call it the bottom side of the TIF as well. This is the mixed use. The reason I want to show you this was at the bottom of this picture right here. That's the Hot Rod Stadium right in the corner here, and you can see what's going to be developed. Hopefully by mid-July, the first restaurant will be open, and all that green space and walkway area there, there'll be 5 or 6 restaurants that are going to be open on that bottom part there. So we're really working hard on that pedestrian area between this HitSense Park Plaza and the ballpark, and those restaurants will be open in phases, but it will be a pretty exciting thing. So they're building right now the 4th floor, and that's where those will be occupied. 2nd and 3rd floor, again, will be built to suit when those are leased out. They're having some actually very good conversations now with people wanting to rent those out.
Doug, go back
Yes,
to
sir.
that picture, please.
Yes, sir.
Where's College Street at?
It's in the front side that you can't see. So
Okay.
this is Commissioner. This is 7th Street, and you would
Okay.
take a right. So this is the back part. The front side, the Chamber of Commerce would be right past there. So this is the back part you can see here. And I think I might have one on that front. I'm not sure, but this, of course, is the Alumni Center building, and it's an awesome building. Something that it's a private WKU Alumni Foundation has built, and they're very proud of it, and they should be. It's an awesome building. And then again, this, to be honest with you, is the original drawing. They've made a few changes. It has a little bit of curvature on the windows, and they did that for some more aesthetics. This is close to it, but not as much. But if you have not been by that building as well, they are flying on that building, doing a great job on that. And that is my presentation. I'll give you a couple updates. We've applied, of course, sent all the paperwork up to the state to get the signature TIF certified from the state. They are in the process of auditing. We have a third-party audit that we have to go through. We have our books audited each year, but we have a third-party audit that we're going through right now, and the state is, we're going back and forth, to be honest with you, trading emails, and what they're doing unequivocally is getting a baseline from that 2008, and they've sent us, there's about 12 businesses that they were showing. What do you know about these that have not, just to be honest with you, have not sent the paperwork in that we've requested? A couple of them aren't in business anymore. Some of them are, and don't. We'll probably have to put a little more pressure on them to get that information. It's no personal information, but it is tax ID numbers, et cetera, and the state is, so we're very close to getting that exact number. And then, after they figured out the first time, it's a little easier because, again, you have that baseline. Then you can hit a couple buttons, figure out exactly what it brought in that year to take that baseline out of there, and then divide up the money that way. So hopefully, we are very hopeful that by June 30th, we would get the first TIF money from the state, and that again is for 08, 09, 10, and 11. And so a somewhat sizable check. Believe it or not, we have all that money spent already, so we have a place for it all, but that will help with every facet of the TIF.
Any questions for Mr. Gorman? Yes, sir.
Doug, what I wanted to ask you about is the College Street side, the Chamber of Commerce side.
Yep.
As we drive up College Street and clear my mind, I know
Yes, sir.
we got other things going on, but the parking structure itself, the view that we have from College Street, what is going on there, and when is it going to be finished?
Yep. I should have given you an update too. Thank you, Commissioner. We are in the process of working with the developer on that, and he is going to put. He is just sent an email this morning. I was in Nashville all day, but I got the email and looked it over, and it's a financing email from his bank and giving us an update. So he's ready to pull the trigger on that. And what they're going to do is build. They're still doing the drawings, but 58 to 62 apartments. He doesn't have the exact, but it'll be probably in the neighborhood of 44 one-bedroom apartments and 18 two-bedroom apartments on that front side all the way up to the top. And I have seen the renderings. They're not for public use yet. That's why I didn't put them on here. But it is something we'll all be very proud of. This is a gentleman who's very, very big into what it looks like as well as how nice they are. They are going to be I don't know if the right word's upscale, but the amenities and things in there will be very nice. These are a very nice apartment. They're looking for young urban professionals to move in there and other people. It's not student housing. It's a little higher grade is what they're looking for, but they have a pretty big history in Lexington and Houston and other places of doing this. And it's a developer that's already invested in the TIF, so we're excited about that. They have not finalized it yet. We're probably about 2 weeks out, and then they'll be able to show that. But they're far enough along architecturally, showing the renderings and going before the TIF Design Review Committee to make sure they can get the sign off and what it's going to look like. But it's very, very attractive. So when it's all said and done, you know, right now it's kind of it is what it is. It's a construction site, but we are about 14 months away from it being completely finished, where there's not dust everywhere. It is what it is. He'll start his construction. Says it'll take him 8 months, but the backside we want to get that the Park Plaza part bricked up on the outside and windows and everything, so there's no, you know, they can do remodels on the inside, but so that there's no more construction, and we're trying to finish all that up. But as far as that front side of the chamber, hopefully within the next year, you'll just be looking at apartments there. Balconies, overhang, it's a very, very great look to it.
So we're not going to have the structure available for parking inside the facility until these other things are completed?
No, and thank you for that question too. Josh should have had you lead this, because obviously I wasn't prepared for that. But no, the parking structure itself will be finished by April 1st. Completely, as far as parking, public parking. That's all. The elevators, we have an inspection, to be honest with you, a week from Friday to sign off on that with building inspectors and everyone there. So once that happens, then it is. And I just had a meeting this morning early before I got out of town, talking with a local merchants group and telling them, and of course what we've all, in all of our documents, it's 4-hour free parking during the day, $2 an hour after that. So that parking structure basically is available for the downtown residents. Now with that, the business people that are renting, their employees have a certain number of passes. It's based on the square footage they rent, and the apartments have a certain number of passes. But again, it's an 855 car garage. It is a mammoth garage, so it will meet our needs, plus be able to do special event for Skypack hot rods and other things that goes on as well. But yes, sir, we're not waiting for it to be open to the public till the rest of it's done. They're just going to might be some dust in there. We can't help that. But eventually, the only thing you'll see on that parking structure, to be honest with you, is 2 sections of it on the Daily News side. We did that on purpose. No, we didn't do that on purpose. I'm kidding. Don't write that down. My gosh. Now, the way it's wrapped, it wraps all the way around College Street, all the way around 7th Street, and all the way around the backside of the stadium. So it really will not look. It'll look like a large office building, not a parking structure, when it's all said and done.
Excuse me. And the main ingress is going to be off of 7th Street.
Both 7th and 8th. Of course, 7th right now is closed because we're doing the construction over it. But eventually, so for instance, if you went to a Skypack event, most people would want to park, doesn't matter what floor, but closer to that, so they can go the elevator right down, right to Skypack. Again, there's an elevator at Hot Rods that's going there. Now, there's other elevators being added because there's an elevator for the apartments. They can use any of the elevators in the garage, but then there'll be an elevator for the apartments. There's 3 elevators for the HitSense Park Plaza, so that when you come in the parking garage, you can go to that elevator in the middle of it and go up and down. But that is on those developers are putting those in, not the TIF. But the garage itself, we hope to have it open April 1st.
Will the garage, once it is open, have a full-time maintenance person there 24 hours a day? And I'm speaking specifically pertaining to the elevators. You know, I've been caught once on the elevator, and I don't want to get caught again. What happens? We're going to have to call the fire department from the inside phone, and I wasn't trying to be funny. I'm serious about that question.
Well, we're trying to figure out if we're going to, if the emergencies, they'll call Kevin DeFebo's cell phone first, or who's going to call. Yeah. But that's one issue we had.
It's always on.
Yeah, always on. We will not have a 24-hour person there. It's going to be automatically attended, so you'll pay on the way out. Again, if it's 4-hour free parking, you'll just get a ticket. If it's less than 4 hours, you just leave. If it's not, you'll pay there. But we do have we are going to have a maintenance we'll have a maintenance contract on the elevator. But as you know, with some of these projects, at the end of the day, we'll probably have to find a company in Louisville. The low bidder that got it's a great company. They have no representation anywhere around here. So we wouldn't want to deal with them, especially if there was someone calling an elevator, because there's no telling when they'd get here. There are local elevator companies, though, that we would probably enter that maintenance contract with. But we will have, there will be all throughout that, of course, you know, the mills have the responsibility for anything in the wrap and any maintenance issues there. They'll have their own. We'll work with them hand in hand to make sure we have the same people in there, but the authority has the maintenance and responsibility in the garage, and we'll take care of that. Yes,
Thank you,
sir.
Mayor.
Any other questions? Thank you,
All
Mr.
right.
Gorman. Unless Mr. Fibbo, you have anything for him?
Just give him a little note, that's all.
All right, great. Thank you for your time, and I appreciate the opportunity. Thank you much.
All right, the next item is our discussion by the Healthcare Committee regarding employee medical benefit consultant contract.
Mike Grubb's going to come up and give a preamble for the business item on the agenda, but just by way of background, the city itself is self-insured for health insurance for our employees. In 2006, the city undertook a sea change activity to bring the cost of our health program back into line and even to reduce that cost. We did that through the development of an employee committee using representatives from all the various employee groups in the city. It was our feeling that we needed to make changes, and if we were going to do that, we needed the support and the involvement of our employees. This health committee has been meeting since 2006 to put together recommendations. We feel that the tail of the tape is one of extreme success. In fact, Jeff, the external auditor asked Jeff this year how we were able to manage our health insurance costs when others around us weren't able to do the same. We were happy to tell the story. Part of that, in addition to the employees' involvement, was the involvement of the consultant. We changed consultants back in 2006, 2007, and been working with the same person. We're a public organization. Right order requires us to go out and to ask the question, is the services provided by this consultant still the best deal for the city? So we went out to a public solicitation. Mike Grubbs will now tell you about that process, and Steve Milam, who is one of the internal leaders of the committee, is going to make a presentation to you, a PowerPoint, if that's okay. Please.
Good afternoon. What I'd like to do is introduce the employee committee to you. Most of the members are here today. As mentioned, Steve Milam from Information Technology, and he'll be up in a minute to do our presentation. Jay Doherty with Parks and Recreation Landscape. Jeff Salings with Public Works Operations. Michael Kiefer, Police Department. Teresa Kendall from Fire couldn't be here this afternoon due to a conflict family-wise. Lori Gray from Human Resources Benefits. And then also Jeff Meisel, the city manager, and I also sit on the committee. Mark Morgan, Michelle Morgan, is also here. He's the consultant we've worked with the last 5 years, so he'd be available if you have any questions. I think Todd Hester and Matt Fuquay from Nice Lukens are also here in case you've got questions for them, or they may want to speak as well as the other bidder for our consulting services. This time, I'll go ahead and just ask Steve to go ahead and come up, and he'll make the presentation. Obviously, if you've got any questions during that time, I'm sure he or any of the other committee members will try to address those.
Good evening, Mayor Wilkerson and Commissioners. Hope all is well. What I want to attempt to do through this PowerPoint is go through the background and tell you a bit about how we got to where we're at today. Go through the agent duties, what Cheryl Morgan has done for us since 2007. Talk about the Employee Health Committee recommendations. Talk about our successes as a result of those recommendations. Since '92, as says here, we've been self-funded. In the 90s, in that decade, we did use some occasional services for guidance and stop loss. In 2000, we hired a broker agent to perform services. In '06, we did bid out the broker agent services, and that's how we came to know Mark and Cheryl Morgan. As you can see there, you can see the departments represented on the health committee. Myself being among the City Hall Annex building. What Mark has done for us, you can see on the agent duties, he has bid out the stop loss. He's made recommendations on that, medical, dental, vision, plan amendments, and coverage choices and changes. He's been very instrumental in guiding and facilitating the committee on various changes and requirements. And he's helped Lori and the committee review wellness programs as well as obtain the Keepers and national survey data on other plans. In 2012, we went out and requested bids for consultant broker agent services. 3 bids were received. We are considering today the bid from Cheryl Morgan and East Lukens. There was a 3rd bid, but it was much higher and is not being considered. After that was released, after some studying, we realized that there were some differences in the definition of broker agent per KRS statutes, which required us to go back and seek clarifications from Cheryl Morgan and East Lukens and amend those responses. Those responses were received mid-December. Agent consultant fees, so how they make their money is this. Prior to 2007, the broker agent and TPA Humana split 15% commission on the stop loss, which current premium is $540,000. 2007 to current, it's a little more of a fixed fee structure. So Cheryl Morgan was reimbursed $29.9 a year plus that 1.5% commission on the stop loss for an approximate total of $38,000 in FY 2013. 2012, the amended bids. So when they came back in after we realized that we had to do some redefining based on the KRS statute, Cheryl Morgan reduced that amount to $25,000 a year for 5 years, which is $13,000 less than was shown on the previous slide. East Lukens responded with $19,000 for the first year and $18,500 for subsequent years. Cheryl Morgan has also offered to pay for a trust fund reserve study valued at $5,000. In their response, you might have noticed it says $4,000, so somewhere between the $4,000 and $5,000 mark. You may have seen that discrepancy, but the value is somewhere between those two numbers. The Employee Health Committee, the recommendations, both bidders did a very, very good job. I can't stress that enough. East Lukens and Cheryl Morgan both did an excellent job. References were very good for both. No problems whatsoever. They were excellent. And as most of you probably know, East Lukens does have a local office, although they are headquartered and consultant out of Louisville. Our final recommendation is to retain Cheryl Morgan due to the following: experience in positive and beneficial working relationship, impact of recommendations and savings for city employee medical costs over a 5-year period, which we will go over in a second, and demonstrated results. Successes since '07, conducted requests for proposals for all lines of coverage. Cheryl Morgan negotiated with Humana, giving employees access to both major hospitals, Greenview and Medical Center, controlling claims, admin costs, and fee increases. Adopted a pharmacy program that uses pass-through pricing, ensuring there are no add-on costs that we don't see that we're incurring. Other successes, the spousal waiver program in '09. We removed 42 spouses off of the plan, made them go to their place of employment as their primary insurer. And of course, there's an unknown monetary impact. It's difficult to measure what impact that's had today, but of course it has. Anytime you remove folks from the plan, there's a monetary benefit to that. Other successes, we've added the 750 plan, which a buzzword, and when we talk about this, it's more consumer oriented. It makes the folks using the plan pay more attention to the cost incurred by the city. Mark was instrumental in helping us come up with the requirements for that plan as well. The low deductible 200 plan, Mark guided us through phasing out of that. and we implemented coverage for over-the-counter drugs for $1. In addition, Cheryl Morgan helped us mark the stop-loss insurance, negotiating favorable renewals, and recommending alternatives to save premium costs. He helped us explore wellness options and bid out life insurance and negotiated carrier change, resulting in a 1% savings in the stop-loss premium. Now what I want to start to go over here is the monetary benefit that I feel and the committee feels that Cheryl Morgan has brought to the city and the taxpayer. From 2007 to 2012, the estimated CPI medical inflation rate was 19.2%. The city's per employee plan cost have been flat and declined a bit since 2007, which is remarkable. FY 07, you can see the per employee cost is $87.93. FY 2012, the cost was $8,016. I would challenge anybody in this room to find another organization that could say they have accomplished that. And to a large part, that's because of Cheryl Morgan. Now, does Mark get all the credit and Cheryl Morgan? Absolutely not. The committee, Mike, Kevin, and Lori take credit as well. But Cheryl Morgan has been very instrumental in accomplishing that goal to reduce the cost for the taxpayer. State and national surveys, which you will see on the next two slides, show that employers pay over $10,000 per year per employee for coverage. Go ahead, Mike. This is a study comparison of Kentucky government. And if you look down at the bottom, let me start over. 2007, you can see that our per employee cost was $87.93. In 2012, if you go all the way over, you can see our cost is $8,016. So we've lowered those costs despite the 19.2 inflation rate, which is remarkable. And to a large part, I attribute that to the ability of Cheryl Morgan. The next slide is a national survey. It shows much the same data. It's not very much different. You can see the comparisons there. They're a few $100s difference, not much. So the national survey is very much in line with the state of Kentucky results. The next slide just reiterates what I told you. 2007, the employee cost per employee was $87.93. If we had followed the medical inflation rate, that next bullet tells you what we would be paying today, which is about the average in both the Kentucky survey and the national survey, which is $10,483. That's in line with both surveys as far as a per employee cost if we had not made any changes and had Cheryl Morgan on board to help us with the plan. Employee premiums have not been adjusted since the 400 and 750 plans were added in January of 2009. City Healthcare Trust Fund reserve has increased by $1 million, or 27% since 2007. The 750 HR plan had $486,000 in reserve to cover run-out claims. All this is attributable to the success of both the committee and the input given to us by Cheryl Morgan.
What does that mean, run-out claims?
I'm sorry, Bruce?
What does that mean, run-out claims?
You know what, Mike, can you answer that?
The city puts in so much money each year to each person's HRA account or health reimbursement account, and as they have claims, those are paid out for the year. So we front load that at the beginning of the year, and then as claims come in, they get paid out. So over 5 years, we've accumulated that almost $500,000. But obviously, some claims would still get paid out of that. But the point is that in addition to the trust fund, we have that other reserve that is above and beyond the trust fund.
I understand. Thank you.
The next slide, as you can see, on average, annual city contributions to the trust fund for employee health care have been $678,300 less since 2007, since Mark came on board, since Cheryl Morgan came on board. And you can see the comparisons and the drastic reduction between 2007 and 2012. Overall, since 2007, the trust fund reserve has increased by 27%, and city contributions are down 13%. in closing, we believe the experience of the long-term savings more than offsets the difference in the responses to the RFPs. The proposed fee is, in Cheryl Morgan's response, is $13,000 less than their previous price of $38,000. So we did, by sending out that second amendment, we did gain that in their fees. And personally, I want to say that over the last 5 to 6 years that I've worked with Cheryl Morgan, I've been totally pleased. And without their input, this is remarkable. I hope you realize that these savings and driving down that employee cost, we would not have achieved it. They've been a great asset to us, to you, and the taxpayers. So with that being said, do you have any questions?
Any questions for Mr. Mellon?
Is Mike going to speak? Or?
I presume so. If you've got a question for him.
Well, I don't know if it goes to him. How much time did the bid process take from start to finish to where we are today?
Well, Mike, you would better answer that, but I believe it was issued in June, and it was reissued mid-December, right, Mike, after we figured out that the KRA statute required us to define the agent-broker relationship. And when was it finalized, Mike? Last month, so June to January.
Okay. I want to thank you all for all that time you've taken.
Yes, ma'am.
I'm kind of confused, though. Why do we go through the bid process and take all of this time from you all and from these companies that have bid if we don't take the lowest bid?
So, personally, and the committee feels that we have been so successful with MARC that the small difference in those responses in those RFPs is not enough to justify to change the mix, you might say. We have been so successful with MARC, lowering that per employee cost. We not only have we lowered our principal, but we've also been able to maintain and not incur that 19.2% inflation rate. That on a $4 million health insurance plan, that minimal amount, that difference in that response, we feel like that we should stay where we're at and keep building on the successes that we have already had.
I appreciate that, but we have no idea what another company could have saved us if we'd gone with another company years ago. Is that correct?
No, you have no idea, but I want to remind the commission that these results are unheard of. I think the city manager mentioned that in his opening statement. You won't find them. You will not find them. And that's not by mistake. That's through leadership, through facilitation with Mark, and him helping us through those tough decisions with new plans, spousal waivers, pharmacy changes, and the like. I understand your concern. I'm an ultra-conservative, and I know what you're telling me. But I strongly feel that the difference is insignificant compared to what we've saved over the last 5 to 6 years.
How are you going to convince me as a company to bid with the city again if I give you the lowest bid and you're not going to accept me? How can we as City of Bowling Green convince people to bid for our services?
Well, so through my life and throughout the city since I've been here, we don't always take the cheaper product for various reasons. I'm a farmer. I work in agriculture. I buy John Deere. Is it 20% more? You better believe it. And I buy that because I get better results and I get better resale value. And I'm maintaining to you that I believe we will keep the better results if we stay with Cheryl Morgan. What you got, Mark?
Can I add just a statement? The RFP was put out as a best evaluated bid, not low bid. So price and cost was 30% of the total evaluation.
We're going to hear from the other people.
Yeah, let's wait and see if I'm
I'm
any
sorry.
questions.
Oh, no, that's it for me.
Okay, Doug.
Thank you, Commissioner Hill. Those were very good questions.
I'd like to echo that. You don't want to leave a good company that you've had great experience with, and that counts for a lot. But then again, what does it take to get the bid if you're the low bidder and you're evaluating it here? And of course, I guess that's a subjective evaluation that we've decided at this point. And what are we saying the difference in the cost is? $6,000,
Yes,
is that
sir.
correct? Okay. Any other questions or comments from Mike or Do you have any comments before I open it up here, Mr. Federer?
No, unless you have comments for me.
Okay.
Thank you.
Mr. Morgan, is there anything that you need to add to that? It's up to you. I'm going to open it to everybody.
Just saying thank you for your business. We look forward to working with you.
Mark, why don't you come to the microphone, please?
Others say thank you for your business, and we're proud to be working with you and looking forward to working with you in the future, and we're happy to be a part of Bowling Green. Thank you.
Thank you. I'm going to open the floor now to Niece Lukens if you have something you'd like to add or question you'd like to ask. Come right ahead. Okay, this is Todd Hester from Niece Lukens Insurance.
Yes, thank you for the opportunity to speak about your health insurance program. We appreciate the chance to have it quoted out and be a part of the RFP process and going over some of the numbers, and I will definitely agree that the Cheryl Morgan Agency has done an incredible job. They've done a fantastic job, better than most of what we've seen. However, there's 2 or 3 things that I would hit on is that your all's numbers have decreased, and the gentleman that spoke previous to me said that that's unheard of and not duplicated very often. We work with a company out of Russellville, Kentucky, Logan Aluminum, that was direct with Aetna for 22 years, and they went through the same process, an RFP. And through us, BB&T, Mercer, Willis, Brown & Brown, we were awarded the contract. At the time, in 2008, they were paying about $12 million a year in medical cost. This past year, they spent $9.5 million in medical cost. So that's about a 20% decrease in their medical spend. Also, some things that recommendations that we made to Logan Aluminum, we haven't taken them all, but one of those was a pharmacy carve-out with Humana, Anthem, and your self-insured. You do have the opportunity to carve out the pharmacy piece. With Logan Aluminum, we did a 24-month script for script repricing of every claim. And as we did that, we found that there was $385,000 in additional savings if Logan Aluminum chose to go that route. Franklin Precision Industry is a client of ours in Franklin, Kentucky with 750 employees. They too were experiencing about 20% increase for 8 years running. They also did an RFP 4 years ago. The last 2 years, they've seen a reduction in their healthcare medical costs by 6.5%. Unlike the city, they're fully insured as opposed to being self-insured. Niece Lukens, as we were looking through the RFP and we tried to be as compare apples to apples, so to speak, we thought and that some of the advantages that Niece Lukens had over any broker, not Cheryl Morgan, but any broker in the state of Kentucky, was that we have employed 4 in-house underwriters with 50-plus underwriting years experience. We have a health and productivity team that we've offered to the city at no cost. We've offered, we have two law firms that we have on retained, one being Baker Hostetler out of Washington, D.C., and the other one, ProScour out of New York City. So the compliance part with the Affordable Care Act becoming more and more important as each year goes by. I would also offer up that Anthem is the only carrier in the state of Kentucky that can directly contract with Commonwealth Health Corporation. So I would suffice it to say that there's probably a 2 or 3% discount advantage that you would gain by using Anthem over Humana. On-site clinic is something that we had suggested that we were instrumental in implementing at Logan Aluminum that we would also look at. And I too would like to know the answer to if we do go through the process again in 3 years, and we respect your decision very much, and But what is that number to where we have to, I mean, if it's not 6,000, initially it was 19,000. And then as we were given the opportunity to go back, they were given the opportunity to see our number and lower their number subsequently. So I too would, is there a percentage? Is there a number that we need to be cognizant of as the next RFP goes out?
I think Mike needs to address that comment that you just made, Michael, about some kind of...
And I do understand also that that was just 30% of the
Correct.
RFP. It wasn't the full. And I will reiterate that the numbers that Cheryl Morgan has they're very good. But
Mike, neither side saw either side's numbers. Is that correct or not?
To my knowledge, neither firm was here at the bid opening. I was not here. To my knowledge, neither one's filed an open records request to know what the other company bid first time around. I know I did not tell either company what the other company had bid.
So we appreciate the opportunity to do the RFP, and but you know, I think it's a 3-year contract, and
It's a 1-year contract with renewables, yearly renewables, I believe. Correct, Gino?
I think that's the way this is written.
so you all have done a great job, and your employees and the committee has done a good job. You know, I wish to duplicate what you've done in a lot of different settings, but I'm not. It's disappointing, but we understand, and we also respect your all's opinion and your choice, because there is loyalty. There's a lot to be said about loyalty and the trust that you have in your consultant and your broker, and we just, being local, we would hope that the next time that we might come out better. But if you have any questions for me.
Yes, Ms. Hill has a question.
Can your firm do an actuarial study? And if so, what would the approximate cost of that be?
We have 4 in-house underwriters and 2 actuaries on staff, so the cost would be negligible. There would not be a cost. It would be part of it's part of our package. We have 4 in-house underwriters. We have a communication team, a health and productivity team, 2 law firms that we work with where we do monthly seminars. We also have, we just purchased $2.8 million software that we were unable to go over the last time we were here because it hadn't been rolled out. It's a compliance dashboard that is customizable to each customer. And if you have over 100 covered, then that's also a free, it's part of the package that we offer.
So we're told we're going to get this study from Cheryl Morgan, and it's valued at $5,000, but they still have the higher bid. You can still give us that study, and it's still included in your $19,000.
Yes. Again, to go back, 4 underwriters and 2 actuaries on staff.
Thank you.
But there would not be an additional charge for
No.
that.
That's part of the package, or part of the program that we bring is niche Lucas.
Any questions for Mr. Hester?
I have a question for Mike.
Okay, hang on just a second. Do you have any questions for Mr. Hester?
Thank you.
Thank you. Mike?
Mike, what would the employees see as changes if we changed to another consultant? How would they be affected?
I don't see any immediate effect. I mean, obviously, they're just affected by whatever changes we do or do not make in our medical plan, and that's based on recommendations we get from the consultant. But there's not going to be an immediate effect, such as a change in premiums or a change in plan design. I guess to clarify, in the actuarial study, that was not requested as part of our RFP. That was just an add-on that Cheryl Morgan offered. But it's not something we requested. And again, it was best evaluated bid, just to make sure it's clear to the public that this was not, whatever the low price, that's who we go with.
Any other questions?
I do have
Yes,
some
sir.
comments.
Yes, sir.
We sat here about 6 years ago making the same judgment and having the same kind of decision whether we change or stay with what we had, and we decided to make a change. And since we made that change in 2007 with the group of employees and our consultant, the taxpayers have saved $3.4 million. So the idea is, how do we measure performance, engage that against potentiality? We know the performance is $3.4 million if we were to stay down the same path. There's an impression that the term low bid keeps coming up. This is not a commodity or a contractual. We're not buying widgets. We're buying professional services. This was an arm's length transaction. Both parties were given equal opportunity to present their profile to the committee. Why it took so long, we wanted to make sure they were comparing apples to apples. That's what took so long. I was insistent on that. Do we need to go out to an RFP? No. But how do you know if there's not some other company that will impress the committee? What if we do not go with the committee's recommendation? What do we say to that committee and the work they have done? We spent 5 months evaluating, trying to be fair. Do we now say that, thank you, employee committee, but thanks for your recommendation, but there's other issues that we have to consider. It was arm's length. We gave both parties. And it was the committee, your employees, who were adamant that they wanted to stay with Cheryl Morgan. So that's all I wanted to say. But we faced the same issues 6 years ago. I remember the very night, if Joe remembers it too, he was there, when we had to make a decision on changing companies. And we made that, and it's paid off for us.
Any other questions for Mr. Febo or anyone else in the room? Yes, ma'am.
As I said in the beginning, I appreciate all the time they put in on top of doing their regular job. But I have to ask, did it concern you at all that their first bid came in at a much higher amount and then it was reduced and it's still higher than the competitor? Did that concern you all at all? I mean, what would have happened would we, the city of Bowling Green, would we keep paying higher prices? We're getting a reduction now because we went through this process. That should make you feel good. But what if we hadn't done that? Does that concern any of you all at all?
Well, it does. The third bid was approximately $75,000, $80,000 from an out-of-state company. Obviously, I can't even remember their name. We consider them very little. So there is obviously somewhere along there's a cost difference. Over time, we're paying less now than we were with the previous consultant or broker agent that we had. Obviously, this process has driven down the price of our current provider, knowing that he had competition. Is $6,000 worth the difference? You know, I guess ultimately you all have to decide that. But what if it had been 15 or 30 or 50? At some point, obviously, in an evaluation, you'd have to say price is important. But in our consideration in the RFP we put out, price was worth a third of the total. And that's why you have the recommendation that you have before you.
So is the recommendation unanimous?
The committee is somewhat, we don't sit around and take votes. There's no minutes. I can't certify that all 8 people said yes, Cheryl Morgan 8-0, but everybody who spoke up, if they spoke up at all, they said yes, Cheryl Morgan.
Go ahead, if you don't mind. Go ahead and, you said 30% was, Mike, was price. Just go ahead and say what the other areas were and what percentage you gave to them for the public to know.
The, well, in the RFP, and it was also in the memo I gave you, price, fees and commissions was 30%. And of course, this was going back to the original, when I didn't know the difference between a consultant versus broker agent. The fees and commissions were 30%. And then we had several general requirements relating to organization experience with public sector employers, self-funded plans, cost containment strategies and references 40%, and then the scope and degree of service is 20%, thoroughness of response 10%. Obviously, these Lukens would have got more points based on the cost. References, we got good references from these Lukens, but obviously they gave us references from companies that they know they've been successful with. And we didn't try to go out and find companies that they didn't give us references on, but they gave us good references. But again, when you look at capacity and experience, then that's where we gave the plus to Cheryl Morgan.
Do you want to hear from any other committee members? Because this is truly, of all the collaborations we've done with our employees, we're always talking about how to engage employees. This employee group has been the most successful, the most faithful, and most diligent in keeping down our costs and working consistently together. And there's other members of the team here. Todd, you want to say anything?
You don't have to, but you're welcome to if you like.
Huh?
We don't want to put you on the spot
I can't
if you
see.
don't want to.
It's up to you. It's time.
These are prepared statements, right?
Yes.
Mike, I'm sorry.
I'm one of the newest members on the committee, so if you all have any questions,
Mike Kiefer.
I'm more than happy to answer what I can.
Did your opinion deviate from what you heard today?
It did not, no. I will tell you I spoke up and chose Cheryl Morgan. So I'll be more than happy to give you my vote and my opinion.
Thank you.
Mm-hmm.
Jay, do you want to speak? You don't have to. This is not like Perry Mason. It's up to you.
I would just add that I don't think I have anything to add to the comments. I agree with the decision of the committee. I'd be glad to answer any questions as best I can.
Did you feel free to disagree?
Absolutely. We had very long discussions, and we did disagree and go back and go over different things. And in the end, we really decided that we felt we were best where we were at with Cheryl Morgan. So we had very open discussions about it.
All right, thank you. Any other questions? Thank you. I know it was a long discussion, and it gives us good information for us to try to consider our decision as we go further in this. Next item on the agenda is there at my request. Over the last several weeks, I had been noticing donation boxes showing up around town, and about that same time, people from the Goodwill Industries, John Wade is here as our local, I don't know the quite title, president of local organizations. And he brought to my attention that they'd had a similar problem in other parts of Kentucky, in fact other parts of the United States, but in specific in Louisville, who had addressed the matter through a code enforcement ordinance about trying to manage the bin system. And he and I met with Dr. Carl Metz, who is out of the Goodwill headquarters of Goodwill Industries in Kentucky, out of Louisville. And I would like to invite Dr. Metz if he would come up and talk to us just for a moment about the experience that they have had with other organizations. And this is not directed at organizations, it's directed at the proliferation of the donation boxes and what it does to our community. So, Dr. Metz, we'd invite you to make some comments on your behalf.
Thank you, Mr. Mayor. Members of the Commission, my name is Carl Metz, M-E-T-Z, and I work for Goodwill Industries of Kentucky as a governmental relations liaison. The issue from our standpoint that these multiplying clothing donation bins present to the community, the issue we think is threefold. Number one, whenever a donation is made into one of these boxes, be it a white box or a green box or any box, those, as they are now arranged throughout the city, those donations leave this community and are not available for nonprofits serving the disabled, the disadvantaged, the shopper looking for low-cost, serviceable goods. Those resources are absent. Secondly, we think there is an issue of transparency in the way in which some of these boxes are labeled. Some boxes are labeled in such a way as to suggest that all of the proceeds from the sale of the goods placed in a particular box go to the benefit of a particular charity, when in fact those boxes may be placed by a for-profit company and a small commission paid by that company to the charity. And thirdly, we think there is an issue of visual pollution that occurs frequently when a community is overrun by these donation boxes. They're not all attended as regularly as they should be, and the goods sometimes spill out on the ground, create an eyesore, and we think in some ways a public health issue. So those are the issues that we see in the proliferation of these boxes throughout the city. Now, let me make it clear. Goodwill Industries has no problem with a for-profit company who would come into this community or any community throughout the Commonwealth and place a box, ask for donations, but label the box clearly as being placed by a for-profit entity. In like fashion, we do not have an issue when a for-profit company places a box and says that some percentage of the value of the goods placed in that box go to a named charity. But we think that there ought to be transparency, and there ought to be some attention paid to the fact that those goods are being taken out of this community and will not be available to serve the interests of the community at a future point. Thank you.
Dr. Metz, with regard to the transparency issue, is there a percentage that is common in your research of these types of organizations?
Mr. Mayor, I don't know that there's an average percentage available. I think it depends on the local issues.
I think I'd read a previous article where less than 8% of the proceeds actually ended up with the charity itself, and I
think that's correct, but it does vary some. But that's probably based on what we know, that's as good a figure as any to take as an average.
Mr. Denning?
Yes. Doctor, just a couple of quick questions. What paperwork does Goodwill submit to the city of Bowling Green, let's say for, and I don't know, and that's the reason I'm asking, permit purposes? Do you have to get permit purposes from the city, from our staff here, for you to have your boxes at different locations? What is the relationship between Goodwill and a permitting process with us, if any?
To my knowledge, Goodwill doesn't have any freestanding boxes in this community. John Wade can perhaps better respond to that question.
Yes, on the property that we own in Bowling Green, we do have a box sitting out there at the front, but we haven't haven't been required to get a permit to keep it on our own property.
Okay.
We don't have any boxes anywhere else.
You do not have to have a permit?
Not for the donation box. You know, we have occupancy permit for the operating of the business, and that's considered a part of the business.
Okay. The point I was trying to get to, there is some relationship with the city of Bowling Green knowing what you're doing on paper versus us driving by your facilities.
Yes, yes.
Okay.
So I want to make a couple of points. One, I invited, I think the entities that I've seen in town is a company called GAIA. I invited them, and a company called ANVETS. Invited Goodwill. Salvation Army is here, represented by Major Ed Benix behind you. A phone call. I also invited St. Vincent de Paul. And it's my understanding that those organizations who are located here, have a physical presence here, do not have an off-site box at any location in the city, but they do have at the place where they actually do their activities. Is that correct, Major?
That's correct.
Yes, sir. And that's correct with Goodwill, too.
I've done some research on it since you and I spoke.
Okay. I'll have you in just a moment then. Any other questions for Dr. Metz? But before I do, we have an ordinance up here from Louisville. Were you instrumental in helping to obtain that ordinance there, sir?
We participated in the discussions in committee, Metro Council Committee, when this ordinance was being evolved, yes.
Tell me some of the experiences that Louisville had with these particular types of donation boxes. Were they regularly attended? Did they end up being a dumping ground for people that didn't want to drive or hire it hauled away?
First, Louisville was experienced a burgeoning of these boxes very quickly over a 3 or 4 month period. And one of these organizations, I think, says that it has 90 boxes in Metro Louisville. Secondly, we have photographs of some of these boxes that apparently were not attended on a regular basis, so that the goods deposited in them spilled out on the ground.
Thank you. Any other questions for Dr. Metz?
One thing I might add, a little research that I've done on it says that some of the materials that are dropped in these boxes from these other companies is actually baled up and shipped overseas.
That's my understanding, yes. But in the interest of full disclosure, I have to tell you that Goodwill Industries does that as well. When we have textiles, for example, that we can't put on the sales floor, we bale them in 1,500-pound bales, and we sell those through a broker. And some of those bales of textiles are utilized here in the United States for various purposes, industries, and so forth. And some, I think, are probably exported.
I'll add something that doesn't mean anything, but in 1971, I worked for Goodwill during the summer and did the baling of those. An interesting process.
You know whereof I speak then.
Yeah. It's a good experience.
I think they still have some openings.
I'll be glad to look into that.
Any other questions for Dr. Metz before I to step back? Thank you, sir.
Thank you, Mr. Mayor. Thank you, members of the commission.
Thank you for coming down. I know it's a long trip from Louisville. Major Benix, did you have some research you had to add this evening?
Well, I have a little bit of the Salvation Army at times has done drop boxes in various places. I've been and may be in the future, so I'm not going to be hypocritical and say I'm against drop boxes. But drop boxes, from an operational standpoint, the experience I've had with them, they are very problematic. If you're going to operate a drop box system, you've got to have somebody, you've got to have the manpower to check them every day. You can't do it once a week because it may be empty today, it may be overflowing tomorrow. You may actually have somebody sleeping in one tomorrow. So it's very labor intensive. I don't have them here primarily because I have neither the manpower nor the resources to operate those kind of things. I would be highly committed to keeping them empty if I did. That said, I went around and looked at several of the drop boxes, and all of the ones I saw were from out of city resources. They were, everything that I can ascertain is going out of Warren County, out of Bowling Green. That's the biggest important, that's the most important thing to me. I'm not from a standpoint of land ownership and, you know, private property rights, if somebody wants to have one, you know, oh well. But let me tell you this. For the first time in 14 years, our shelter is to a point where we got people sleeping on mats on the floor because we're so full. The clothing and shoes that are going into those drop boxes, we could be doing first, putting them on our floor to sell to low-income individuals. And then those that don't sell, we would bail them. And I know what they're doing. They bail them up and they sell them overseas. I'm the one that personally deals with the brokerage firms. I know how that works. But when I do sell them overseas, the money comes right here to Warren County and gets used right in our facility. So what I have a real problem with is resources that I could be using to help people in Bowling Green is leaving. That's the real problem I've got. The Gaia drop boxes, it says right on it that it's going overseas. Just on a whim, I called AMVETS and said, how do I get help from AMVETS? The girl on the phone didn't even know what I meant, how to get help from AMVETS. She said, what, do you want to make a donation? I said, no, I want to see how do I access resources, you know, how do I get help from AMVETS? Well, she put me on hold for about 10 minutes while she tried to figure that out, and then came back and said, go online and try to find a chapter nearby. And I did. Franklin is the nearest chapter. I don't know what service they give, but all I know is I think Bowling Green resources should stay in Bowling Green and help the people that are here. So that's really all I have to say about it.
Thank you, Major. Mr. Denny.
Well, having two major presenters here, the boxes that we are seeing at different places, who are they and where are they from and so on, I guess?
I have seen three, there may be more. Gaia, the green ones that you see, and they are marketing as a green company for recycling, saying that they're keeping things out of landfills, but they're doing that by, I suspect, selling them overseas, which is a good thing. Those clothes are used for good purposes, don't get me wrong. I saw AMVETS, and I saw, Ohio Mills for Special Olympics, out of Cincinnati. Now I got to say, they all looked empty and well kept. I have no complaints so far. The ones that have been running it have been keeping them clean. I've not seen any junked up boxes yet. Again, I'm just based on resources.
So I guess we know what both of you do. Yes. And you're to be commended for that in every way possible. Help me out as one of the ones seated up here. What do we do and how do we go about policing this problem that we've got?
Well, that's a city policy question I'm not sure I have the answer to. I will tell you, as if I were in a community where I had drop boxes, if my drop boxes were overflowing, I would not be shocked to be getting citations for overflowing drop boxes. I know that because I've had that. Okay, I've actually moved drop boxes because I couldn't maintain them.
Yeah, and I understand that. I guess my question, maybe I didn't ask it the right way. These companies, are they non-profit companies, even though they may be doing something, sending it here, there, and so on? I'm trying to get my mind focused on the fact that we have people used to have that would come in here and be at Broadway and the bypass with buckets in their hand. We've taken care of that. Any Tom, Dick, and Harry comes in here, they first got to go and get a permit to do that. What do we do here? Are we saying, and I'm on your side, I'm like old Jerry Clower, I'm on your side. What do we do to prevent what is happening, I guess? I don't know whether I'm asking it the right way or not.
Joe, may I ask
Yeah.
you to do that, maybe? What would happen if we prohibited all drop boxes of that nature in the city? How would that affect you all?
Currently, it wouldn't affect
you all
me at all. However, it would say, I would say to myself, oh, well, that means I won't ever have drop boxes in the city. I would like to have them. Don't get me wrong. I would like to have the manpower to be able to keep them cleaned out and to bring in the resources that they bring. I would be a bit hypocritical to say, yeah, you should ban them, because I would like to have them.
I think that's where Joe was.
Yeah, here's my problem, and or my lack of focus, I guess, and understanding. We say yes to both of you, outstanding organizations worldwide. We know what you do. Old Joe Denny wants to put a box right out here. You know, he's a pretty fair person. He's going to want to put a box out there, and Joe Denny collection. And I'm going to keep my box up. What is going to prevent me from doing that? And if there is something that is going to prevent me from doing that, is that discriminatory?
Right. I'm a little conflicted, and you're bringing up exactly the point that it conflicts me. Every year at Christmas time, we have our people out there ringing the bell. Now, they're on private property, just like a drop box is. They're collecting. They collect about 20% of our entire income for the year. And so what concerns me is, and I feel like I'm arguing the other side for a minute there, but what concerns me is that if we could say no drop boxes, we could say no kettles. And that's where I'm a little conflicted in the whole thing.
Or if Joel Osteen's church down in Texas comes here to the city of Bowling Green, gets the proper paperwork, permit, and he's already talked to Mr. Walmart down in Arkansas, and they say he can do it too. Mm-hmm. Have somebody out there with a bucket.
Yeah. Because we get our permission from Walmart in those cases.
Yeah.
So.
That you're manning those.
So
you're manning those. There's somebody there.
There's the difference there is we don't put a kettle up unmanned.
Right.
I mean, it's not going to sit there and be overflowing with clothes, and we don't even allow the kettle workers, for instance, to accept in-kind goods.
Yeah.
If somebody wants to buy angel tree gifts, it says right on the back of our sign, this bell ringer cannot accept in-kind gifts. So there is the difference right there, is it being manned.
Yeah. Well, and I understand that.
Now, in some cities, I will tell you that when the drop box back to the drop boxes, some cities, because of ordinances, they will actually have a trailer. There's a Salvation Army does this in places, yeah. And there's a man who sits there all day and takes in the things. Now, it actually works really well because they pack it in the trailer and they lock up the trailer at night and it's not overflowing. But then, of course, after 8 or 9 o'clock at night, no telling what can happen after that, but you're back to it being manned. And it does actually work pretty well. I know it works in Nashville.
I wanted to make mention of the boxes that we have in front of our stores. They're for one purpose, and that is to keep it from being trashed in the front, because people come at hours when we're not open, and if they don't have some place to place the stuff, they just throw it out in front of the store. So we were trying to not litter up the community.
Sure. And
that's what we're getting to.
Sure, I understand.
Yeah.
And that doesn't bother me personally at all.
I think
I guess my going back to my concern is if someone is doing something legal, how are we going to prevent them from doing it?
I don't know that we can actually do that legally in our society, but the thing I think that is important is the transparency part as much as the cleanliness of a community with not having boxes that are going to have a lot of litter around them. And that is truly let the community know where these donations are going and how much is being paid to who out of the donations. Because I think the average person driving by, they see Special Olympics logo on the front of the box. It's their assumption that all of it's going to Special Olympics. And it's 6 cents or 7 cents on the dollar is what's actually going there. So it's, to me, a little bit misleading to the public, and that's what bothers me a lot about it.
One of the biggest questions we get from in-kind and financial donors is my donation staying in Bowling Green? Right. That's a big question we get. Those drop boxes can't answer that question. I mean, not without putting a disclosure right on there. And I can tell you that it's been my experience that there's a lot of donors in this area would not give to something that is not going to stay in the area.
Commissioner Denning, I think probably the bottom core, the core of the answer to your question is if the Bowling Green City Commission determines that it has a problem in one regard or another with these donation boxes, the way to deal with it is a local ordinance that would require it could require several things. It could require a permit fee. It could require a registration by the entity placing the box or boxes as to where they place those boxes. It could require them to have a regular maintenance schedule for those boxes and so on. You could, in other words, regularize the operation of those boxes through a local ordinance if you choose to do so. Now, there are some communities in the United States that have banned boxes altogether. Probably the most prominent of those communities is Miami, Florida. It said, no boxes. On the other hand, there can be some constitutional issues raised with a ban of that, with a total ban of that sort, but probably the best way to get at the problem is zoning ordinance.
I have one more question.
Sure.
All the boxes that are here that are not Goodwill, they are on someone's private property. Am I right? So that business has given them permission to place that box there, right?
It would appear to be the case, yes.
Okay.
But in Louisville, for example, we had, and we still have at the moment, a situation where there are a lot of boxes placed at the curbside that, among other things, interfere with the sight line for traffic. So once they start growing, they're much like rabbits.
Well, there's one on Scottsville Road that I'm thinking of. It's close to the access road near Ashley Circle, and it's not placed very well, probably.
Do you have a question? Well, I was just wondering if we know if any of these boxes or the people who are placing the boxes are paying the property owner a fee to have that box placed there.
That I don't know. I can't answer that question.
I can tell you the Salvation Army never pays to have a box, but it's usually done as a donation whenever we're in the communities where we do it.
Well, I would love to be in a position without any hesitation at all to say that Goodwill and Salvation Army could put the boxes wherever I want to. But I know if we said that, old Joe Denny is going to want to put a box out there, and if he can't get his box out there, he's going to come down here and raise sand and possibly file a suit being discriminated against, so on and so on. So all of my questions is based on, yeah, I'd love to get rid of all of it, but I don't think I can. So what do we do?
Gene, can we?
I think it's probably a strong argument that you can prohibit them totally. I understand the constitutional part, but I think probably aesthetics, home rule, we could probably prohibit them. But they had a great answer, I think, to that question. Because I really hadn't thought about what happens if you don't have a box. You're right. If I'm there at 8 o'clock at night and I got my trunk full of stuff, I don't think I would do it, but I would see some people. I'm not going to keep this stuff in my trunk for 2 or 3 days. I'm going to dump it at the front door. I haven't really thought about that issue, but I think that was a good answer to that. And one thing that the Louisville ordinance does too, I like this information issue and making sure that everything's transparent. I like the part they put in there that makes everybody understand and aware that if you put it in one of these for-profit boxes, this is not tax deductible. Because I guarantee you, if I see a Special Olympics box and I put clothes in it, I'm thinking that's tax deductible and people are taking it off their taxes. And I gather it's maybe 8% of it might be, if that's the percentage going to the nonprofit, but the rest of it's not. But people are taking it off their taxes as a deductible contribution. These folks, it clearly is, because they're 501c3s. These others aren't. And people think that, though.
Yeah, but how do you go about, what do we do if we see one there and all it's got is his name and address? We've got to do some homework to find out whether or not that company is...
Well, the Louisville ordinance has language in it basically said if you're a for-profit company, you're required to write on the side of the box that this is a for-profit company and contributions made to this box are not tax deductible.
Well, why don't we do that?
Well, we've got in front of us, we have Louisville's ordinance, which gives us a lot of regulatory information. There's probably a couple of different items we could. I know Mr. Feva wants to interject here. Go ahead.
That's okay. Maybe we can consider this like we did with signs, where we heavily regulated signs. I agree with Gene that we need to probably totally abate this, or if not, make it very heavily regulated. I know we're all opposed to regulation and fee permitting and all these bureaucratic things. So how I see it, either abolish it, and that it's an eyesore to our community, which they are, I think. Brent and I took it right about, and they are a number that are becoming visual pollution, I think. And we don't want to clutter up, like we don't want too many signs to clutter the community, right? We worked hard on that. We eliminated that. We did the billboards. I see the same thing applying here.
Don't we already prohibit off-premises signs?
Yes.
For a business that's not. So I wouldn't mind the fact that Goodwill and Salvation Army, who have their boxes on their location, that's part of their business at that spot. But if I've got a gas station and I've got the box out sitting by the road, there's really no relationship with there.
You're getting what I'm trying to say. Right.
And I asked, I don't know that our sign ordinance covers that right now. I talked to Mr. Hunter, who's also here today, about building permits. They're not required because of the size of the square footage of the structure, but there is an issue with sight lines and setbacks and all that sort of thing, no matter what the structure is. So I don't know which route we want to go. We may want to...
Well, one thing we're going to have to be very clear is how we define these drop boxes, because there are other drop boxes out there besides these particular kind of boxes. Last I checked, the Postal Service has boxes. FedEx has drop boxes. UPS has drop boxes. So we have to define what we're talking about.
True. Yes, sir, Mr. Green.
No, Mr. Wilson makes an excellent point there. We don't want to be taking up no mailboxes and stuff.
Isn't today in...
I didn't go there, did I?
But again, the Louisville ordinance had a pretty good definition.
Yes.
It's got a pretty good definition.
Mayor, I would love to see us develop some, city manager and...
we can take a whack at it, Joe. If you give us about a month or so, we can come back with some outline of ideas that would help coalesce what maybe your options if you want to do that.
That sounds good to everybody?
Sounds good to me, as long as we focus on the fact that Goodwill and Salvation Army, there's no problem with their operation and what they do.
Make sure I understand here, the consensus here, you want to keep them. You just want reasonable regulations on them.
The ones that are here we want to keep? No, not necessarily.
I just assume it'd be, we'll look at whatever options you put up.
Okay.
I like the option if you've got a physical location that you can have that box. Yeah. If you don't have a physical location, it's an off-premise sign, which is not related, and I'd like to see those prohibited. I don't know that we have that authority.
I agree with that. Plus, with national security, I mean, this sounds absurd, but you have all these boxes that could be places for people who can put bad things. I talked to a police officer, they don't like this. I mean, they're just places for garbage sometime.
Well, they got a drop box out in front of the police department, what, for hazardous materials or needles or something?
Thank you. Well, appreciate that.
We don't want to prohibit that one.
Heavy drugs.
My last comment would be is the best summer job I ever had was at that position at Goodwill.
But we kind of have an idea. You want? Have you got an opening?
Very well.
We take volunteers.
It was a great job, and I appreciate my experience at Goodwill, and it's exposed a lot of very positive things while I was at Goodwill.
If we went with the on-lot theory, that you can have a box if it's on lot, would that affect you all? That would be good for you all, right? That would be good for you all?
Okay. Mr. Hunter, you had something to comment? And Quentin Hughes is here from Operation Pride. If you have anything to add, please feel free.
Steve Hunter, the Planning Commission. Let me just real quick on the off-premise sign issue. I think that would be an interesting way to address the boxes. But if there was some kind of financial arrangement, I would guess, let's say convenience stores rented the space, there could be a tie-in that the business is there. There is a business tie-in. So the off-premise signage route seems questionable to me that you could say, well, the business isn't there. That is a business component of this other business if there's some tie-in. I totally was just focusing after we talked about the structures themselves, and maybe there's a prohibition of the structures all by themselves, regardless of what the signage is or the use is or who owns the box. Because I agree with the other commissioners that there's all kinds of drop-off boxes, red boxes and UPS boxes and Insight, and there's stuff all over. And I mentioned to you, Mayor, that I think the zoning ordinance is somewhat silent on temporary uses, but by default it's very clear on what an accessory structure is and what you can have on your property and what you can't have on your property, and what's storage and what's a building and what's a structure and where they go and where they can't go. And in commercial lot, I could see some ways we could regulate that just with the accessory structure standards now if we were to enforce the letter of the law of the zoning ordinance right now.
Would you be kind enough to forward that language to Mr. Harmon, and maybe we can make a determination in the next couple 3 meetings or whatever?
Yeah, we could make an easy argument that they're temporary structures not permitted by the zoning ordinance under a certain circumstance. Maybe that's the route, as opposed to the signage or the use or the owner or the charitable versus commercial entity. Just what is the structure and where does it belong on the lot?
Okay.
That's kind of the only thing I could find.
All right, thank you. Any other comments or suggestions? I want to thank Dr. Metz, Mr. Wade, Major Bennix for being here today. I know Quentin Hughes stayed overtime from Operation Pride to be here, Mr. Hunter, and thank you, Mr. Childers. I never got to ask you a question. Thank you for the discussion, and we'll do our best to come up with an adequate solution to address Bowling Green's issues. Any other issues to be brought at the work session? If not, we'll recess until 7 o'clock for our regular meeting.